I welcome everybody. So we start the session at 8:45. We will wait for some other people to join us. Hello Archana, hello Dipti, hello Kirti, Meenakshi, Priya, Priyanka Jain, Srinivas, welcome everybody. Vardharaj, Ashish Sharma ji, Kavita ji, Sunita, Vidhu. Hello Tirumagal. I request everyone to keep their camera on if they are comfortable, because it's going to be a very interesting and interactive session. So good evening, friends. I am your host, Ashmita. I welcome you all on behalf of Mindful Living for another wonderful session. We thank everyone for taking out your time from your busy schedule on Friday evening. It is so wonderful to see you, all of you. So before I invite, I would like to speak few words about our speaker, Dr. Nupur Agarwal. So just to let me say a few lines about her. Dr. Nupur is a mind-body medicine expert. She uses multiple therapy in her coaching and group session. Experience of more than 5 years in treating cancer patients with this therapy. She has got her research work also published. So, and also about today's session, it's going to be a very, very interesting session. It's about, the very powerful tool which many of us are not, aware of. It's about, a missing piece to the healing mystery. So that mystery we are going to find out from Dr. Nupur. And she has also got her research published and all. So, and she's closely worked with cancer patients and all. So I would like to invite Dr. Nupur to take on the session today so that we all can benefit from here.
Thank you so much. Thank you, Ashmita. Am I audible, Ashmita?
Yes.
All right. Wonderful. Thank you, everybody, for joining us. I'm going to stop sharing for a moment because I just want to see everybody and connect with the participants. And just to get a sense of who all are here, it'd be lovely if you can switch on your videos for a little while. It'll be wonderful to see you all. Wonderful. Thank you. Thank you for everybody who's switched on their videos. Really appreciate that. It's always good to have faces to the screens. The session today is on mind-body medicine. And it's about understanding the power of mind-body medicine in our healing journey, whether it's cancer or whether it's chronic health conditions, whatever we may be facing, a diagnosis, a mental or an emotional condition, a physical condition. So how can mind-body medicine help us to navigate this space? And before I put up the presentation, I would just like to tell you about myself. I am a clinician. I've been working in the medical, I'm trained as an oral medicine and a radiology physician specializing in oral cancer. I worked in that space and transitioned into complementary medicine, which is mind-body medicine. I am a mindfulness teacher. I'm a cancer coach. I'm a life coach, and I am a medical hypnotherapist. For the last 5 years, I've been working, in fact, more than that, been working at an NHS hospital in London where I was offering, I can hear an echo. So I don't know if it's me or somebody has to be on mute. Ashmita, is it all right? Okay, perfect. So in my work, I have been working for cancer patients. I started with head and neck cancer patients, moved on to working for blood cancer patients. I did that for 5 years, helping them to transition and move through their journey, all the side effects of chemo, radio, surgery, and also all other effects on this mental and emotional health. So that's the space I was working in. I was doing subconscious reprogramming. I've been doing mindfulness for them. And my research has also got published. My research palette has got published. I've had some research papers I can show you here. So so as I'm speaking, please feel free if anybody wants to share anything at any point. I'd be very happy to take questions as we go along. But so this was a case study of a severely needle phobic patients. A patient who had was undergoing bone marrow biopsy, and she wasn't able to because of extreme level of pain, stress, and phobia, needle phobia. If you can see the graph here where my cursor is, so we have got, see, on literally on the first biopsy, all her levels are high, blue, red, and green. And over the sessions where we did hypnotherapy, we did mindfulness and managed the patient's concerns, to see the levels of all the three have come down drastically: the pain, the fear, and the phobia. So this is just one of my studies that got published, and there are many more that I'm very happy to discuss with you as we go along. Really understanding what does mind-body connection really mean. It means that what we think, what we believe, and what we emote, and what we feel has a deep impact on our body, right? And in my work, I have come to see that firsthand. I have worked with so many patients, as I was saying, so many clients in my private practice as well, where it's very evident that what we are undergoing mentally, emotionally, physically is impacting our health at a very deep level. Also, in my experience and my medical as well as my complementary medicine experience and my training, I've come to understand that our body has a natural self-repair mechanism, right? This is the intelligence with which the body is already endowed. So our human body is very intelligent, right? And imagine we have all come from single cell, two cells fusing, and then resulting in such a multicellular organism with such intense, extensive organ systems that are intricately, connected to each other. So there is a very deep intelligence in the body, and this intelligence is what heals the body. This intelligence is actually a very intelligent. It's almost like we've all seen this, haven't we? When we have a cut, and we have got a cut on our hand or on our legs, when we have had a fall, when we are playing a game, we don't need to do anything. We just need to wash off the wound. We just need to allow the body to heal. Body has all, if it's a healthy functioning body, it has all the tools. It's got the light platelets that will come to make a clot to stop the blood from oozing out. It'll have its various stages of wound healing. And all that we need to do is to allow that to happen, to enable that to happen. So there is a very intelligent field. There's a powerful field of intelligence that exists that's taking care of the body on its own. Now, what happens is when this goes haywire, when this goes a bit off kilter, and we get into the modes of fight, flight, or fright, right? And that's the space that I'm going to talk and make you understand that what is it that is preventing us from accessing that space? What is it that's going on that's keeping us in our stress mode? Because I'm sure if any of us here have had a chronic health condition or cancer or any other challenge that we have seen doctors, we go to doctors, and every time, so many times we hear the doctors say that, take care of your stress levels, get your lifestyle in check, notice, where you're letting your body get completely engulfed by the stress. So, this mind-body medicine is a very important field that is helping us to understand where are we going wrong? What can we do to enhance our own healing? How can we impact our body? How can we enhance this natural self-repair mechanism that already exists? What can we do to trigger this? And that's what the discussion and the conversations are going to be about. As I'm going to go through these slides, I'm going to also keep discussing with you because I want you to all participate and engage with me. So for that, let's do a small exercise. I'm going to invite you to do a small test, which is called the lemon test. So I'm going to ask you to just close your eyes for a moment. And I hope you're not multitasking. So if you are, just for a few moments, Just close your eyes, be with me. We're going to do a small fun exercise. And I'm going to ask you to imagine a lemon or a lime in your hand. Just imagine you're holding a nice lemon or a lime in your hand. And feel the texture, feel the texture, feel the wobbliness or knobs or just how it feels to touch. And now I want you to imagine that you have a knife with you. It's a very, very ordinary knife, nothing to feel threatened by. Your instincts will guide you to cut through this lemon into two halves. So go ahead, cut this lemon to two halves or lime, and now bring it closer to your nose. Now I want you to bring the cut halves closer to your nose. And I want you to smell it. And now I want you to open your mouth and just allow a few drops of this lemon or a lime. Squeeze a few drops in your mouth. Keep smelling, keep engaging your senses. And now just notice what's going on. Is saliva coming up? You can keep the knife down, you can keep the lemon down, and just stay with your experience. And I would request anybody to open, all of you can open your eyes now, for all those of you who've been doing this, and tell me, how did that feel? What did you have any experience? Did any sensations come up?
Yeah,
Anybody
Nupur ma'am. Yes, it's Meenakshi here.
Hi,
I
Meenakshi.
got the smell of lemon. It's really, I was shocked.
Interesting. Okay, so you could smell the lemon.
Yeah.
Okay, and Manoj has written that he could actually have the saliva in the mouth. Okay, anybody else?
Me too. Smell and the saliva, both.
Oh, so for you, you had both saliva and the smell. Very interesting. And just it was a very short, like it was hardly a minute's exercise. So this was something that we can go into the details of, and that's the space I'm going to be taking you in to understand that. Mr. Bhatnagar also is saying that he could smell and taste and saliva. So this is the power of imagination. This is the power that we all have, and our bodies respond to a mere thought. Now, I really want you to understand the power of what I'm saying here. None of us had a real lemon in our hands. None of us really had anything squeezed in our mouths. But the sheer power of imagination is enough to trick the body into reacting and responding by releasing certain chemicals, and saliva is a chemical in the mouth. And this is a very, very small experiential thing that I wanted to take you to understand how powerful your mind and body connect is. We are multisensory beings. And what do I mean by that? We have multiple senses. We have the sight, we have the smell, we have the touch, we have the hearing, we have taste, but we don't use all our multiple senses. I would just request everybody to check that they're muted, please. Thank you. So we are not always engaging in our multisensory experience. And the more we engage with the mind-body therapies and mind-body medicine, we understand that for us to feel, heal, and thrive, we have to engage all of us and not just stay at the level of mind, a thinking mind, which kind of triggers a lot of emotional responses. So let me go back and share again and tell you that our bodies are is a field of energy, right? And you experience that. And if some of you didn't experience that, that's absolutely okay. It's just that you needed more time. For some of us, we need more time to process these things, right? And also, where do we feel in the body? So this is a very interesting question that we will come back to. But before we come back to that, I want to talk to you about the power of your nervous system. We all have a very powerful nervous system. And the part of the nervous system that I am very interested to speak to you about today is about the autonomic nervous system. This is the nervous system that is actually governing most of our disease processes and our recovery and thriving responses. So we have something called the parasympathetic nervous system, and we have something called the sympathetic nervous system. Now, sympathetic nervous system is what's responsible for our stress response. It's responsible for our fight, flight, or freeze response. Now, what is this response? It's the response that's inbuilt in us. It's taken care of by this primitive, or it's called the lizard brain, the limbic system. There's an organ called amygdala. Without getting into too much anatomy and physiology, what I would really urge you to is to understand that this is not something which is for doctors to understand. This is for all of us to understand. You as human beings, because you have a body, because you're able to process information, you all should know this. We all should know this, that what is stress response? What is stress really? So just go back a few hundred years back. We were all cave dwellers. Our ancestors were not living in the conditions that we have today. We were living in more like caves and more nature, natural spaces. And there we had certain threats, and those threats were very, very clear about our survival. We had tiger roaming around, we had snakes around, and we could be bitten, we could be eaten by these predators. Now, the stress response was actually there to keep us alive. It's called the survival response. It would trigger a certain biochemical responses, which we call the HPA axis. Again, without needing to go into details, what we need to understand is it triggers certain centers in our brain that release biochemicals, neurotransmitters, hormones. And these are what trigger us to either run or fight. It will supply blood to our major muscle systems. It will supply blood where it needs to, and it shuts the supply in our digestive system. It shuts the supply in other areas of the body. It increases supply in the heart space. Why? Because we need to combat the threat. We need to fight, flight, or freeze sometimes also happens. Now that's the stress response that is a survival mechanism. However, in today's time, that response is still very active, but we have forgotten to shut it off. And it's getting triggered by simple things like life, by our relationship. It's getting triggered by our bosses. Just requesting everybody to mute themselves, please. It's getting triggered by our work deadlines, by our financial situation, by COVID. It's getting triggered by our health conditions. Now we are forever in a stress response. And what that means is it's almost like having your foot on the accelerator constantly. And the stress response is forever triggered. And this is releasing a lot of chemicals. So we must understand that this human body is the most active chemical laboratory. Every other chemical that is ever produced outside is only receptive in the body because we have chemical receptors for that. That means our bodies is the biggest laboratory ever, the biggest chemist ever that's producing all these chemicals that are either keeping us well or unwell, right? So the stress response triggers chemicals like cortisol, epinephrine. And once these are forever releasing, because we are constantly in a state of stress, they are what's contributing to a high level in our disease processes versus the relaxation response, which is triggered by the parasympathetic nervous system, right? And that is the soothing relaxation response. And the biggest game changer in our healing journey is by triggering the relaxation response, because our bodies, our cells, our organs can heal only when we are in the relaxation response. And we have enough research to tell us this. So if there's one thing that I want you to really understand today is that no matter what you are going through, you can gauge in your life whether you're in a fear state or in a relaxed state. Because if you're in the fear response, you're in the stress response. And that's going to create triggering these chemicals that are contributing to the imbalance release, resulting in illness or disease. To the point that when somebody has a diagnosis, right? A diagnosis of a chronic health condition, diagnosis of cancer, this stress response is what gets triggered. And unless we know how to manage that response, it can keep escalating and escalating our illness. And no matter how many rounds of treatment you go through, how many medications you are taking, if you're on painkillers, unless we understand that we can influence and unless we bring the body in the relaxation response, we will forever be dousing ourselves with medication and forever feeling completely at a loss, as a victim. And that's my whole intention today, is to introduce to you to a paradigm which I work in, the mind-body medicine space. that, you know what, let's not have all our focus on illness, let's focus on wellness. There's in fact a term that is called in Japanese, that's called karoshi. It's a very interesting word, which says death by overwork. Death by over, there's actually something like that. So you can imagine how much of our reality or of our life is impacting our health state. And I have trained with a lot of pioneers of mind-body medicine. And one of the persons that I've actually trained with is Anita Murjani. And she's written many books, and she's a very, she is called a medical marvel because she had a near-death experience at the point where she almost went into multi-organ failure. And she was almost declared clinically dead because she had stage 4 lymphoma, and all organs failed, and she had a near-death experience. She went through a whole paradigm called near-death experience, and when she got back into the body, she came back with wisdom, a lot of wisdom on what we need to heal really, what can she do to heal? And then she has relayed all this information to us. And she recovered from stage 4 lymphoma, what she had been going through for the last several years, maybe 3-4 years, in a matter of months. And she was discharged and she was declared cancer-free, and all her medical records are still there in the hospital. And she's a medical marvel, but she's not the only one. We have projects like the cancer remission projects. You know, there's a lot of science and literature that is telling us, not just for cancer, for chronic health conditions, what can we do? How can we impact our healing and our recovery? And that's the space I'm discussing with you today. Through this study, which is a Finnish study conducted by scientists in Finland, it talks about the way our body stores emotions. And this is something I really want you to understand, that our bodies actually store emotions. The emotions that we feel, the thoughts that we think, they trigger certain responses. And in our body, we can store. So this was a mapping of the number of people they studied. And there was amazing similarities in which people felt that they were processing their emotions. People were storing their emotions. And this is a very fantastic study. And the reason I'm sharing this with you is because we are launching actually a course, a workshop that I'm going to be talking about by the end of this presentation. And this workshop is talking about what can we do? How can we influence our wellness? How can we help our bodies to heal? How can we manage pain? And once we know that all the emotions that we have been feeling are deeply impacting because they're getting stored in our body. And a lot of times unprocessed trauma, unprocessed emotions that we at human level are not dealing with are impacting our conditions. So I have been working with cancer patients, as I mentioned. And a lot of times when I'm doing sessions with them and I ask them, if this tumor could speak to you, if this cancer could speak to you, let's go deeper. So when we access that intelligence of the body, that intelligence that is keeping our hearts beating when we are sleeping, that intelligence that's keeping our breath moving when we are busy working. When we connect with that intelligence and we ask our body, what is this tumor trying to tell us? The revelations that are revealed to the person are outstanding. We can actually communicate with an organ, with our tumors, with our disease, and we can actually understand why are we facing those? What's really going on in our body? What is it that we have left unfaced? What emotions have we left? What traumas have we got unprocessed in our body? And once we do that, once we understand that, and once we understand the art of releasing, we can then slowly start to be a partner in our journey to wellness. Right now, what we do when we get diagnosed with something, it's almost like you have a machine, like you have a car. When the car breaks down, you just take it to the mechanic and you expect them to fix the car for you, right? And that's exactly the way we deal with our human bodies. We feel that your body is not a part of us. We just feel that, yes, something has gone off. Let's take the body to the doctors and let's expect them to fix. And then they have their own ways of dealing with us. And I am here to tell you that by all means do that, to go ahead, consult your physicians, consult your GPs, But do understand that it's your body. You have the first connection with it. So connect with your bodies and know that you have to be a partner in your journey of healing and recovery. Don't outsource your bodies. We are so good at outsourcing everything these days. Don't outsource your healing and recovery all to a team. Be a part of that team. Be a part of that process. So I remember that one of my patients who had head and neck cancer had severe xerostomia. Xerostomia is complete lack of saliva in the mouth. That's a very common side effect of radiotherapy, especially in head and neck cancer patients. And this patient was referred to me by the dietitian and obviously their oncologist. And what happened was that this patient, we don't appreciate the role of saliva in our mouths. I'm able to speak to you because my mouth is moist. You're able to eat because your mouth is moist. You're able to digest, swallow food because of saliva. So saliva is key, has multiple functions to perform. And when this patient had next to zero level of saliva, he couldn't speak, he couldn't swallow, and basically his tongue had become red and bald. And when he started doing sessions and when we started contacting this intelligence in the body, we actually started implanting like water hose. We actually starting telling the body to start releasing the saliva back again, started re-engineering the salivary ducts, the salivary production. Every organ in our body is represented in the mind. So we not only speak to the organ that is affected, we also talk about that part in the brain that has the controls of that organ. So we are doing multiple level work here. And within 3 to 4 sessions, this patient had remarkable production of saliva to the point that it was measured in the clinics, it was measured by the dietitian, and he was back on oral feeds. He was back on ability to chew food, eat food, speak, swallow. So this is the power of the human body and the human intelligence that you can access. And I can go ahead and share multiple case histories with you. As I said, my research pilot got published in the European Journal. If any of you are interested, I'd be very happy to share that with you. But the most important thing, that the key reason for you to understand, is that you can impact your wellness and your healing in multiple ways. So don't think that you are helpless, or don't completely get into the paradigm of illness. Start focusing on wellness. There is a term that is called psychosomatic, and it's a heavy word, epigenetics. Again, these are very heavy words. The reason I'm talking to you about these is because these are relevant to our lives. These are very relevant to our daily existence. We need to understand what does psychosoma means. Soma is related to body, psycho is related to the mind. Psychosomatic medicine is a field that is saying that a lot of times the conditions that we have, fibromyalgia, autoimmune disorders, lifestyle conditions, strokes, cardiovascular conditions, diabetes, a lot of these are considered to be conditions where there is a massive component of our thoughts, feelings, and emotions. And we just saw that they all get stored in the body. So how can we access this intelligence and influence and enhance our well-being? That's what these psychosomatic medicines talks about. And epigenetics, the father, I would say one of the pioneers is Dr. Bruce Lipton. And he says that we are not the victim of our genes. We've all heard these things that, cancer, breast cancer is there in my family. We have the BRCA gene. I have the gene for hypertension, diabetes. And we kind of almost feel that just because we have genetic predisposition to something, we are a victim. It's almost like a death sentence. Till this study called Epigenetics came around by Mr. Bruce Lipton, Dr. Bruce Lipton, and many other pioneers, that is telling us that no, for a gene to express itself, it has to be in a particular environment for it to get triggered. Unless the environment is good and healthy, that gene may not get expressed at all. So you don't have to worry and live in fear. That gene may just not get expressed. And what switches a gene or on or off is the environment of the gene. And what is the environment? The biochemicals in the body. Do we have cortisol? Do we have stress hormones? Do we have pain hormones, or do we have well-being hormones? Are we soaking in oxytocin, which is the love hormone? Are we soaking in adrenaline positively to the right levels? Dopamine, serotonin, these are the positive life-affirming biochemists. And these are what impact whether a gene is getting switched on or switched off. And that's the power of epigenetics. So the course that I'm going to be talking to you about, the workshop that we have designed, is about understanding that you have a very key role to play in your healing journey. You have to understand, are you activating your parasympathetic nervous system? Are you activating the relaxation response? Are you understanding how can you communicate with the body? Are you understanding where these emotions are getting trapped? What are these thoughts and emotions that you have left unprocessed? There's a book called Body Keeps the Score. And it's a book talking about how trauma gets stored in the body and is accelerating the disease processes, right? So there is so much literature and so much evidence that we have now to understand that let us take ownership of our healing. Dr. Joe Dispenza is again one name that I would really want all of you to think of, to research more on. He says that your personality creates your personal reality. Your personality creates your personal reality. Dr. Joe Dispenza had multiple fractures of his spine, to the point that the surgeons had said that even if he goes through spinal surgery, he will be on wheelchair, he will not be able to walk again. Dr. Joe Dispenza decided not to go the route of surgery. He decided to self-construct his spine, and I'm talking about multiple fractures here. He healed his spine, he reconstructed the spine, the fractures healed, and within weeks, 8 to 12 weeks, he had started to walk. And within 3 months, he was back on his feet, walking, and then within 6 months, running. And this is a guy who was told by his doctors, by the surgeons, that even if he had gone through the surgery, he would never be able to walk again. So are you understanding the impact that your own thinking can have on your healing? But we need to learn this. We need to understand how can we impact ourselves. And that doesn't mean by any chance I'm saying don't go to your doctors and surgeons, but understand your key role in enhancing your well-being. Thoughts are the language of the brain, and the feelings are the language of the heart and the body, right? How we think and how we feel creates the state of our well-being. And how we think and how we feel actually create and release the hormones, as I was talking about. And a big aspect of this journey is understanding your subconscious mind. Our subconscious mind is almost that part of the pyramid. If you can imagine an iceberg, the part of the iceberg that's visible to our eyes is the conscious mind. And 95% of that, the part that's submerged, is our subconscious mind. And subconscious mind is the space that's holding on, recording. It's the hard drive of the computer. It's got all the data, it's got all your memories, it's got all your emotions in it, right? So this is the aspect of the mind that is most active from 0 to 7 years, but it's forever recording and playing things in the background. And one of the biggest key influencers in your healing journey is your ability to access your subconscious mind, because subconscious mind is what's controlling our autonomic nervous system. Autonomic nervous system, or the involuntary actions that are happening in the body. The kidney is filtering, the heart is beating, the liver is metabolizing. All these processes, to a greater extent, are being controlled by our subconscious mind. And we can impact, and we have an influence over our subconscious mind. Unless we learn these techniques, unless we know how to do this, we can forever be left almost like a headless chicken, not knowing how can we influence our well-being. So one of the key areas of my specialization is reprogramming and re-engineering your subconscious mind. And that's what I teach. In all my sessions with all my patients, I teach them these techniques. I take them through this, and I also teach them certain tools and ways in which they can impact, they can harness their parasympathetic nervous system, they can access their subconscious mind and create a space of homeostasis towards creating a state of wellness, impacting the release of the right hormones that are helping, talking to the tumors, talking to the disease, speaking to the pain. We can actually communicate with our pain because our pain is there to speak to us. Our pain is not to make us suffer. Once we understand that we have the ability to communicate with our pain, we can really enhance our pain management. And that's what we do. Power of visualization. This is again one of the most key superpowers that we all have, that we use in mind-body medicine. Now, this is again a very powerful space that I want you to understand, that our brain is not static. For the longest time, like just the way our heights were static, people thought you stopped growing after the age of 18. People thought our brains become static. No, we know that there is something called neuroplasticity, right? Neuroplasticity means that our brains are constantly evolving and growing. We can constantly start to create new neural pathways. Now, when we are diagnosed with a condition and we go down the fear route, we are fearful. We go into a fight or flight response. We are activating a sympathetic nervous system. We are going down the neural pathways which are set around fear, right? Unless we understand that we can create new neural pathways, we can trigger the relaxation and healing response in the body. And those neural pathways are what will lead to the shifting of the disease, to the reduction in pain, to the reduction of the tumor size. And how do we do that? Along with our subconscious mind, we do it through the power of visualization. Because as I was saying, our brains don't know the real from imagined. If I today ask you to imagine color red, and if I put a red apple in front of you, so you are seeing the red apple versus you are visualizing the red apple, the same areas in the brain get activated. And this is a whole breakthrough in the world of neuroscience, because that means our brain doesn't know whether we are actually experiencing an event or we are imagining an event. And I would like to ask all of you today, don't you experience this? If you've gone through a very painful emotion or a very emotional experience in your life, and you start narrating that to your friend, don't you start to well up? Don't you start to feel teary? Don't you feel almost as if you're reliving that event again? And this happens to us even in a movie hall. When we are seeing a movie, or even sitting in our rooms these days and watching something on the telly, and something really triggers you so much that you become so emotional, or it reminds you of an incident that might have happened in your life and you become so emotional. And so many times you may experience yourself saying, oh my God, I'm feeling it as if I'm going through it again. Now, why is that happening? Because your body and your brain doesn't know whether that was past or this is the present. The body only understands the language of the emotions. The brain processes it as if it's happening in the now. Now, this is a very, very powerful science for us to understand, because that means we can actually visualize our way to healing. We can visualize the outcomes that we want. And this is exactly what Dr. Joe Dispenza did. Dr. Joe Dispenza recreated the spine. He healed the fractured segments. And mind you, when the spinal cord fractures, we have something called the vertebrae. And it's very important to align the vertebrae in the right way for the spinal cord to pass through them so that the discs are aligned. Now, he was an osteopath. He knew this. But that's not important. What's important is he used the power of visualization. He used the ability for him to access his subconscious mind. He used the activation of his parasympathetic nervous system, and the ability to speak to the intelligence of the body to recreate his spine completely through the power of visualization. And I have seen profound results. One of my patients had become water phobic. And when I say water phobic, I have a plain cup of water here. She could not drink that. After radiotherapy, she had certain trauma. After surgery, she had certain trauma that completely made her phobic of water. Only thing that she could drink was flavored teas and coffees, or she could only have juices. She could not even flavor water and have it. And obviously that was impacting the quality of her life. Imagine if you can't drink plain water. We just did 2 sessions. And by the time it was a second session, she had the first glass of water with me after a whole 1.5 years. And all that we did was we triggered her power of of connection with her body's intelligence. We trigger the ability of visualization, and we release trauma from her cells and her cellular memory. That's the power of visualization that I'm talking about here. And that's what I teach to my patients, and that's what I'm going to be teaching in this workshop that I'm going to be talking to you about. Also, there's something I want you to really understand and discuss here is that, I don't know if you've heard of something called the phantom limb phenomena. Sometimes what happens is that for war veterans, especially for soldiers, it's very common, but it can happen to any human being. We've got a part of our body amputated. Maybe you've lost a leg, or you've lost an arm, a part of our arm. Now, though we may not have the physical arm, but we still feel pain it's called phantom limb. It's a phantom because it's a ghost. That part of the body is not there physically, but because that part of the body is still represented in the brain. So our brain has representation of every organ and every part of the body. So because that part of the body has still representation in the brain, so you can still feel an itch. You still feel the itch in that hand, and you still feel the pain sometimes in that arm. And that is the power of your brain. It's called the phantom limb phenomena. Really look it up. There is so much that, I would like for us to share and understand in this journey. But before I go ahead, I would ask you, what is your intention from this workshop? What brought you here? Let me hear from you all. Why have you taken a precious hour out of your Friday evening to come to hear about mind-body medicine? What is your intention here? What are the questions that you may have, having heard me so far? And then I'm going to go into explaining certain key questions that people here who have come with either some chronic health conditions or perhaps cancer, or for carers of some patients can really ask themselves. But before we go on to this slide, I would really want to stop sharing and have some engagement. I have been speaking for almost half an hour, and I would really want you to ask me and share with me, what are your intentions? Why are you all here? Unmute yourselves. If you have any questions, please ask me. Put on your cameras. So let's have some discussion before we go on. I think I saw. Hello. Please, yeah, go ahead, Mr. Kujal.
I'm Johnny from Chicago.
Hello, Mr. Johnny.
Friday morning.
All right, wonderful. I'm in the afternoon, and a lot of people from India in the nighttime. Yeah.
I am here basically because I suffer, and I'm constantly in need of some sort of answer, especially of using my mind and intellect to overcome, because the sort of problems that I undergo is more pertaining to anxiety, depression, a little bit of OCD. And in spite of the fact that generally I've been doing very well from the eyes of the onlookers and friends, I'm successful. I have been an ex-Navy guy also. Now, in spite of that, I suffer internally. And I tried.
Is it my network, Ashmita, or have we lost Mr. Johnny there? You unmute yourself.
We have lost him.
Okay. So I believe we are recording this, and are you? Yeah, we are losing your sound.
Meditation, total
yeah,
fix in what is medical hypnosis, etc.
Okay. So we lost your voice there. I think the network wasn't. Yeah, please go ahead.
So I have experimented with yoga and meditation, and gone pretty much deep into studies of scriptures and all those things. And I have seen the glimpses of cure. So I have got that hope that yes, one day I'll be able to definitely get over. Instead of mind controlling me, I'll be able to control the mind. That is the summum bonum of my thought about joining this workshop.
Wonderful. And I'm really, I'm very appreciative of you sharing your experience, Mr. Kojail. Forgive me if I'm not pronouncing your name well. But I want you to, and everybody to understand that, life happens to all of us, and whatever we may be going through, the biggest space that I want, the awareness that I want to create through this workshop is bringing my experience. Now the talk that I'm giving today is not a hearsay. This has been my medical experience of years. This has been my experience in the mind-body space for the last 7 years that I've been working in a hardcore cancer space and a private space. And the shifts that have happened are not the shifts that I have created. These are the shifts which the people themselves, the people I've had the privilege of working with, the whole thing is within us. We just need a facilitator to tell us, to guide us, and to show us that this is possible. And today, the day and age in which we are living, there is so much information. There's so much amazing information out there. We have people, as I was talking about, we have Dr. Eben Alexander. He was a neurosurgeon who himself went through something which is near-death experience. And he came back with such wealth of information talking about the power of our bodies and minds and the intelligence that we all have that can help us to heal. Now, the biggest question is, how do we access? It's not about now, no longer the if doesn't exist anymore. So my intention is that today I'm going to be talking about my workshop, but whether or not you join the workshop, go ahead and do your research and find out that if is answered, it definitely works. We have enough and more evidence. Now ask yourself, how can I include this in my life? How can I create those shifts? How can I, our medical model is fixated on illness. How can I shift from that to wellness? What do I have in my ability to influence my healing journey, right? So this is the space which I'm bringing you. And hope is the word that you used. I would say go from the word hope to trust. That's even more empowering. Trust, and that happens. And a huge part of the work that I do is about belief management. Beliefs are so important in our healing journey. We can believe ourselves into sickness, and we can believe ourselves into healing, health, and wellness. And there is a whole science called placebo and nocebo. And we're going to dive even deeper into that when we do the workshop. What is placebo effect? How are we able to, a very quick thing, in World War II, we didn't have enough morphine injections to inject to the soldiers. So one doctor started injecting saline injection. They were just plain saltwater injections. And you from Navy, you know that, right?
Yeah.
The soldiers were getting the same pain relief as from those who were getting morphine injections. What's going on, guys? It's because of the power of our mind. Our mind thinks we are getting morphine. And endogenous, we have something called endogenous morphine also production that we understand how we can trigger that. And because even though they had salt water injected, they got pain relief. They were back on the track fighting. Right. This is the power that I'm talking about. This is what each of you have. All that we need is somebody to help us understand.
Thank you, Preeti, for bringing me here.
Thank you, Preeti, for bringing yourself here.
I joined this at the very last moment, at the very moment you started. So it was, again, a matter of destiny that I had to get connected with you.
Wonderful, wonderful. And Mr. Shah is raising his hand. I'd be happy to answer him. Yes, please.
Yeah, hi, this is Amit here, calling you from Pune. I hope I'm audible.
Yes, sir, you are.
Okay, so Nupur, unfortunately, I might sound a pessimist, but I have been working on this mind-body connection, and I have consulted some of the best people in this field. And despite all of that, somehow it has not worked. So what I would really want to know from you is what sort of success ratios do you see? Everyone talks about the successes that you have had, and those are very valid successes. And but what sort of a success ratios do you have? And for the ones where you are not successful, what are the main reasons for the failure to happen? Because for every
Yeah,
one Anita Murjani, there are like millions of
yeah,
people who die because of cancer.
yeah,
So if it was
absolutely.
so
That's such a,
easy, it was so
yes,
easy to follow
yeah.
her, then we won't.
Yeah.
Cancer is today
And
the
my
fastest.
intention, Amit, is thank you for such a powerful question. And I'm not even basing my work on a few words and names. I'm basing my work from the hundreds of patients that I have personally worked with, and from my experience and from my data, right? And it's the reason I say these names is only because there'll be many people who may be not wanting to come on the workshop with me and experience the healing journey. For those, I recommend these books and these names and all these there's so much self-help tools that are available. But I base my work only on my experience. I base my work only on my statistics and only on my data and nothing else.
So what
And
does
you're
your statistics
absolutely,
say?
yeah, my experience says, Amit, that um, every cancer, every chronic health condition has its own prognosis, has its own impact on the body of the person. But I would say that no person will ever leave feeling demotivated, because when we understand that, and a big part of the journey is also acceptance. Whether are we living in resistance or are we living in acceptance? A lot of times what happens is when we have a diagnosis which has really created havoc in our life, we are driven by the fear mode. We have to understand how much of this are we resisting? How much of us are we fighting? Can we get into a space of acceptance, allowing, and then relaxing with it? Now, what happens is a lot of times what we have been told, Amit, is that we have to fight the cancer. We have to fight the condition. We have to, really force ourselves into a wellness mode. But my work is not about making you into somebody who is going to be obsessed about recovery and healing. My journey is to allow the acceptance to come in. How do you accept where you are in your life? How do you allow the fear to be there, but how do you manage the fear? How are you processing your difficult emotions? How are you processing your difficult journey? That is a big part of the process, right? That's a huge part. So sometimes what we do, we enter a treatment, a therapy with a lot of fear and non-acceptance and resistance. And that's not going to help us. And so many times when you lose a battle, that's the common word people say, I have lost the battle to this disease. My loved ones have lost the battle. And my job is to say that nobody ever loses a battle. Sometimes people have to go through that journey because their bodies have got affected by it. But tell me, if one of us has the choice to pass away peacefully from a condition rather than to pass away full of regret, resistance, hatred, and discomfort. Now, my intention in this space is not to create a space where we can do pain management to a great extent. The pain management that I have seen has had 50%, more than 50% success, 30 to 40% in the research that has got published. There's 30 to 40% pain reduction, 30 to 40% anxiety reduction, symptomatic relief, neuropathies have come down, peripheral neuropathy, numbness, side effects,
This is in
nausea,
100%
vomiting,
of the cases,
everything comes down.
and this is in
No, not at
100%
all
of the
100%. No, not at all 100%, but 30 to 40% is huge. Plus
no, no,
the
30,
ability to
40%. Hold
accept.
on, 30 to 40% reduction in the intensity, or in 30 to 40% of the cases,
Intensity.
the so intensity is by 30 to 40%, and in how many cases does it go by
And the
30 to 40?
cases
Okay,
also.
30 to 40% cases and
It
30 to
has gone
40%
down.
reduction in
Yes, it
intensity.
was.
Okay.
No, it was almost 50% and above. I would say in almost 50% and above patients, the pain meds have come down, and so the thing is, with a diagnosis like cancer, we have to understand, or chronic health conditions, which mode are we playing in, and that's the space. We have to understand that we need to come. Okay, I'm getting a response that we have 2 more people having questions. Okay, we'll come to that. So we have to shift our space from the stress into acceptance and allowing. And the moment we do that, we come into a more homeostatic space where we allow the body to heal. to the extent the body can heal. And I'm not saying everybody is going to go into remission, but the quality of the life, that's the key thing here. What is the quality of your life with which you're living, right? So Amit, I'll come back to you, but let me ask Elaine and Sunitha. Elaine, would you like to go first, please?
Hello, Doctor.
And I'm going to be putting up, hi Elaine, I'm just going to also put up this presentation so that people can, at least review these questions and take a screenshot if they need to, because I'm mindful we might be running out of time. So I'm just going to still put, yeah, Elaine, go ahead, please.
My question basically is in relation to my mom. She has a terminal diagnosis of cancer now. She's successfully got through it twice before, but she also has other illnesses like rheumatoid arthritis, which obviously is autoimmune, and she has dementia, Alzheimer's. In the case where somebody cannot control their own thoughts or are even aware, like she doesn't have very much long-term much memory, so like she's not aware she has any of these things, is there a way to help people that can't really use their own thought process to start to heal themselves? Well, I suppose somebody else to heal for them.
That's such a powerful question, Elaine, and thank you for asking that. It brings me to my knowledge one of the patients that I worked with, and I always have their carers coming in, so first of all, fabulous job, Elaine, to be taking care of your mom, and the very fact that she has your love and you around, that itself is such a big part of a healing journey. There's something that I want to share with everybody, and thanks to Elaine for bringing this up. It's called the observer effect. What does observer effect say? Now, the observer effect is a part of the quantum physics. It was first brought out into light by the quantum physicians. And it says that when you change the way you look at something, the thing you look at changes. Once again, when you change the way you look at something, the thing you look at changes. They were observing that the particles, these subatomic particles, this quantum physics, subatomic particles behave differently when they were left on their own, and they behaved very differently when somebody was looking at them. So sometimes they would exhibit wave nature, sometimes they would exhibit particle nature, right? Now, this phenomena is being used a lot in our mind-body medicine. What are we saying here? Observer effect. The way you look at your diagnosis changes when the way you look at your diagnosis, your health condition, your tumor, your loved ones changes. You start creating a change in them. So when you look at your mom, not as a person who's undergoing and who's completely ridden with all these things, but you see her in a very positive light, like a being, like somebody beyond the diagnosis, somebody beyond these conditions, and you start projecting a lot of your love. And when you start looking at her in the wholeness model, that she is beyond the mind body, she is that energy field that we know now. We are not just this cells, we are energy. We know now that most of our cells are nothing but hollow spaces. So we are a field of energy. So when you start changing the way you look at your mom, the way your mom will start feeling will also start changing. How are we approaching the people that we love? Are we feeling sorry for them? Are we feeling that they are a victim of a condition? Or are we seeing them with the light of something much beyond the mind-body medicine complex? And once you shift that, Elaine, you'll be surprised that the field will start to shift. And once the field starts to shift, that's what we talk a lot about in the mind-body medicine. When your intelligence is projected from that level of high vibration of love and radiating that energy to her, she will start responding in that way. Because now, and that's what when I'm working and I'm giving talks in the hospital, one of the key things I tell the staff, the nurses, the students is, don't look at patients with a sense that there's something wrong with them. Don't look at them with a sense that they're victims. See them in an empowered state. The moment you start seeing them in that empowered state, they will start responding to that vibration. So go ahead, do your research, look at observer effect. We are going to be talking about that also in our workshop. When we change the way we look at something, when we change the way we perceive our challenges, when we change the way we are seeing our cancer. Just yesterday, I was working with a patient who said that I want to get rid of my cancer. I want to get rid of this tumor. I said, of course, by all means. But this is also a part of your body. Can we approach it without resistance? Can we include it in the harmony of the body and not create more resistance around it? You know, so how are we communicating with the body? How are we wishing it away? And that's the big difference. So even if the statistics may say whatever, but each patient starts to feel a shift. Each person starts to feel a shift the moment they get into the space that my life, my diagnosis is not against me. It is here to help to maybe make me love myself more, maybe find answers. How can I enjoy my life? How can I live my life to the highest? And this is what these key questions are asking you. Suppose you did not have what would I be doing if this diagnosis was magically taken away from me? How would my life look? How would I be feeling? What does my body need in order to heal? Is anything keeping me from my most authentic self? What do I think might lie at the root of my illness? If I can drop the diagnosis and shift my focus, where will it go? You know, these are the key questions that I want all of you to take picture of and ask yourself, because a lot of times we are so absorbed in our diagnosis that we have actually forgotten that we can also focus on other things. We can allow ourselves to live a life of a much more quality. The focus has to shift. And the moment that focus shifts, we automatically get into a space of healing. And this is what I'm not saying it. This is what the patients are showing. This is what the people are showing. This is what the literature is telling us. But it needs perseverance. It needs practice. Visualization, the key to visualization is repetition, persistence. Dr. Joe Dispenza didn't heal his spine by doing it one day and getting disappointed by it. He kept doing it again and again. So that's where facilitators who are channels like me come into the place. That's where we handhold you that, you know what, try this. This didn't work. Okay, fine, try this, but do this regularly. Learn the technique to do it. That's where the work comes. I have had sessions, 8 and 10 sessions with people. So if the patient is able to have the saliva back, if the patient with severe neuropathy who could not walk was able to walk for 15 kilometers after the sessions, why? That's because of the consistency. That's because of the trust, and that's because of allowing themselves to believe that this is possible, right? So this is what's very important. We're almost towards the end, and I really want you to understand that the power of our beliefs. You know, this was something Roger Bannister broke. Earlier, it was believed that to run a mile, all the scientists, all the physicians, all the sports medicine people said you can never run a mile in less than 4 minutes. Till Roger Bannister came along and he ran a mile in 3 minutes and 59 seconds, which was unbelievable, unheard of. And from the day he broke the record in 1954, just weeks after that, somebody broke the record in another part of the world. And from then onwards, it's a common thing that we hear that his record was broken. Somebody has run a mile in 3 minutes as well. So what is the key thing here? When one person believes it's possible, it breaks the mass myth that it's not possible. It breaks the mass hysteria that, oh, cancer, not possible. Oh, fibromyalgia, not possible. Reversal, not possible. Why? Because so far we have only focused on what's not possible, is the power of our belief. But now the quantum physics is telling us, no, you are not the mass. You are not just the matter. You are the wave. You are the energy. So access the intelligence, access the field. And I'm not saying you will get into remission, but allow your journey to be of wellness. Allow it to be much more healthy. Allow yourself, don't deprive yourself of you. We can't die before we die. We need to have quality in our life. We need to have, the skills to live a beautiful life, even though we have a diagnosis. And mind-body medicine is what's helping us to achieve that, with managing everything alongside, right? So what we resist persists, and we all know that. So the intention of my work is to understand that can we embrace all parts of us, including the fear, including the anxiety, including the stress and depression. We are fixated upon releasing things. We fight them out. But my experience has taught me, my research, my all the patients that I have worked with have taught me, no, it has to be done with embracing, not by pushing anything away. Right? So it's understanding that I'm allowed to feel the fear. I'm allowed to feel everything, but the journey is how can we feel them, not suppress them? How can we embrace them? And we do all this by learning the art of communicating with our bodies. Because I'm just going to give you one thing. Tonight, when you go to sleep, unless you have a flight to catch in the morning, don't put your alarm. Just speak to your body, just speak to your subconscious and say, please wake me up tomorrow at such and such time. And I can guarantee you, you will be woken up at that time. If not today, by practicing it in 2-3 days, you will definitely be woken up at that time. We have not experienced the art of communication with our body. We have not spoken to our disease. We have not spoken to our tumors. We have not spoken to our pain. We just feel that, oh, the statistics is not showing, so why should I do it? My doctor didn't tell me, so why should I do it? Well, did your doctor create your heart? Or why, do we even know how our heart was created? Do we even know how our heart synchronizes with the rest of the body? Everything in the body is happening on its own. It has a very vital intelligence. What happens is when we are so fixated on the outside, the work, the challenges, the relationships, we forget to take care of our body. We forget to connect with this intelligence, and then disease happens. Emotions, we don't know how to deal with emotions. Nobody has taught us growing up. If you're feeling upset, if you're feeling sad, if you have got abused, if you have got sexually molested, what do we do about this? We just store the traumas in us. And then when we start speaking to our conditions, we realize the memory is coming back of an assault that happened 15 years ago. Traumas are coming up. Hidden pains are coming up. Unprocessed grief is coming up. And that's what the body is storing. So unless we learn the art of communication, how can we expect our bodies to heal? And that's what the science is telling us. This is something which I'm going to ask you all to do. Write a prescription for yourself. Self-prescription. This is the work of Dr. Lisa Rankin, again, an expert in mind-body medicine space. And she has recommended do your own self-prescription. Yes, by all means, go and follow what your doctors are saying, but do this also. Believe it's possible. Get the right support. Listen to your body. Understand what does it mean to have an intuition. Diagnose the root cause of your illness. Till date, we only know how cancer is formed. We only know how fibromyalgia. We don't know why. So find out the root cause, communicate with your body, write a prescription of wellness for you. And those questions that I asked you to take a picture of earlier will help you to create that prescription. And surrender the attachment to outcome. Every time you are going to keep thinking that you have to beat this condition, what is happening is you are resisting it. Allow it to be there. Yes, I have this. Can I face it with love? Can I allow it? Can I accept it? And with acceptance, what is the best that I can do today? Am I going to allow myself the ability to embrace all parts of me, including the fibrosis in my lungs, including the pain? And the moment you shift your focus from resistance to acceptance to allowing, you activate the only part of the body that can heal you, which is your parasympathetic nervous system or the relaxation response. And I am not saying it's going to happen overnight, but become a partner in your healing journey. Participate in your wellness and don't be fixated on the illness. That's the intention. And the workshop that's coming up is the first of its kind, which is happening after a lot of the tools and techniques and the experience of, it's not something which I have designed, it's what has been designed by the people I've worked with. And I don't even like calling them patients because I don't like to reduce any human being to a label. We talk about in this mind-body connection, in this workshop that's happening, how can we go beyond labels? How can we go beyond diagnosis? How can we go into our own intuition? How can we access the space within us? And the program aim is to all that I have talked about. right? If any of you want to take a screenshot of this, please go ahead and take it. It's about understanding that your subconscious mind can be accessed. Your relaxation response can be accessed. How can we do mindfulness? Because mindfulness is saying that thoughts is not who you are. Your emotions are being felt in the body. We don't know that we have we are so fixed. It's like having you're living in a multi-story building and you decide only to live on the terrace. You have other floors also. Why don't you live on the first floor, the ground floor, the second floor? When we don't connect with our body, we are living only in our minds. This is what happens. And we stay in fear response. We create those vicious cycles of rumination. So understanding that what takes for us to heal is by recognizing the thoughts, the fears, and by coming into the alignment and then feeling elevated emotions of appreciation, gratitude, trust, hope, and positivity. Now, these are the emotions that create the shift in our journey, right? So all of this is the aim of the program. And who should attend this program is people who have been diagnosed with a range of conditions, but also for the carers, people who are taking care of somebody. And this is also for people who are emotionally and mentally very vulnerable. Sometimes we feel that, I'm an empath, somebody is an empath. They feel that they've been victimized in their life, right? And they're constantly in the energy of victimhood. And blaming the diagnosis, blaming the circumstances, blaming the healthcare professionals, blaming their family. Now, if some of us are in this category, it's very important to understand that we can never enter a state of equilibrium, homeostasis, by feeling a victim. We have various levels of consciousness, right? There's a book called Power versus Force by Dr. David Hawkins. And that book talks about that every emotion, and this is documented, it's studied and researched, every emotion that we have has a vibration, right? Now, victimization, feeling shame, guilt, victim, they have the lowest vibration. And when we are vibrating, it's almost like, imagine you have on your FM, you put 86.8. Now 98.3 also exists, 101.2 also exists. These are all frequencies. But you are tapping into the frequency of 86.8 FM. That's a vibration, that's a frequency. If you're tapping into 86.8, you will not hear 102.3, right? Now, the same way, when you are vibrating at an emotional vibration of feeling victimized, feeling grief, then that's going to be your vibration. That's what is going to attract more of, because that's the arena at which you're vibrating. How can we move from these lower vibrational states to higher vibrational states of acceptance, of neutrality, of compassion, higher states of kindness, love, gratitude? So this is how we move up the level of vibration. And we know we are not the matter, we are the energy. So the moment we start vibrating at a different field, the same time our cells start to vibrate at a different field. Our molecules, our tumors, our fibrosis, everything starts to vibrate at a different field. So this is the content of the workshop that I'm going to be talking about in some time. And it's not something that has come up by reading books or by reading my medical school. It's come up about 7 years of our experience. It has come through as I keep saying, through my research articles, through these patients who have been phobic. When somebody has to go through head and neck cancer, they have to get for radiation, they have to get masks made. And these masks make a patient feel very claustrophobic. How have we dealt with phobias? How have we dealt with fears? Fear is paralyzing. When I was talking about fight, flight, and freeze response, the freeze happens because of the fear. If you are in a fear mode, you will not be able to allow the body to respond to anything, whether it's chemo, radio, or surgery. You have to shift your gear. Pain management, somatic sensing is becoming aware of your body, deep tissue healing. Now, all of this, what I have put together is through patients, through experiences, through documents, and through the studies of Dr. Joe Dispenza, Anita Murjani, Bruce Lipton, because for me, it's a part of my, it's a part of my profession. I have to be updated. Now, all of you cannot be going through all the literature, but if you can, by all means, please go through it. Empower yourselves. Even if you choose not to participate in the workshop, empower yourselves and know that you have a lot in your hands. So please don't just stay a victim. And the cancer or the condition could be there, but you could live a much more fulfilling life by just asking yourself the questions that I asked you, by giving yourself the right prescription, by changing the way you perceive something. So I'm going to ask Ashmita to take over and discuss with you the details, and I'll be very happy to take the questions after.
Thank you, Dr. Nupur. So we have this session start. Thank you, Dr. Nupur. So we will have online sessions. There will be 2 sessions of 2 hours each, starting from this Sunday. The first one is on 13th of Feb, and the second one is on 20th Feb. And we will also have 3 bonus sessions for all the participants. The dates for the same will be announced shortly. The timing will be from 3:30 p.m. to 5:30 p.m. Indian Standard Time. The actual course fee is 3,499, but we have a special offer for next 24 hours. If you enroll within next 24 hours, it's 2,999, 2,999 for the participants of this workshop today. So we have facility of doing Paytm or Google Pay. We will just share the details of the number on which you have to do the Paytm. So that's my number 9136336070. You can do either Google Pay or you can do Paytm. In case if you have a problem in doing Google Pay or Paytm, we can also provide you our bank details. So you can let us know. And also this particular fee is a very small fee. It is just for a cause. And I would like Dr. Nupur to, focus on this thing,
Yeah, absolutely. I mean, the money or the fees is not even a reflection of the power of this, but the intention was because it's Cancer Awareness Month, and the 4th of February was Cancer Day, World Cancer, International Cancer Day. And the reason was that I was speaking to a friend of mine, and she was saying that, that not everybody has access to the services that the mind body medicine and complementary medicine specialists have and offer. And for those of us who are still feeling victimized because she is undergoing a very difficult autoimmune condition, she said, how can I be empowered? And we started discussing that the awareness of this mind body medicine and this space of self empowerment in this field is very limited. And the intention of this program is actually to create awareness and to help people empower themselves. So the cost is actually not even a reflection of the in-depth work that's gone into it, the research and the kind of things that you will receive. And also understand that once you learn the power of self-regulation, of positive influencing your health and disease process, it's a lifelong skill. I have had patients who have learned these things from me, and when they were sitting in a dental chair, they could use the pain management technique there. They managed to help themselves in pain management. If they were going through dialysis, they were able to manage the dialysis. And in fact, one of the patients had come in the previous. So we are doing this webinar for the second time because so many of you requested it to be rerun. The webinar we did on Saturday actually had one of the cancer patients who came and she shared her journey of how she was able to help herself through all the tools and techniques that she learned, right? And the reason I can't get a lot of hospital patients is because of the confidentiality. We can't do that. But that's the reason she was a private client of mine, and she very voluntarily herself asked to share her experiences. So we have that video also on our YouTube, on Ashmita's YouTube channel, on Mindful Living channel. If you want to hear the testimony of her, you can also access that video. But the intention is to understand that at every stage in our life, no matter what is our diagnosis, we go through a lot of emotions, we go through a lot of fears, we go through a lot of symptoms. And these, once you learn these techniques and tools, you can use them at any point in time. And we already have 14 or 15
Dr.
people who
Nupur,
have registered. Yeah, go ahead.
I have also pasted the YouTube link so everybody can go and subscribe and see our videos, which we have already posted. because we've done some wonderful sessions in the past. So you get an opportunity to, see each of them. And while we are, going through this session, I would also request everybody to fill up the feedback form and also join our WhatsApp community so that you can be aware of, we will announce the various programs so you can be part of our family. So
yeah, absolutely. Thank you for that, Ashmita. And if anybody has any questions, I would really urge you to ask me now. Any hands that I probably, I'm sorry, I missed seeing earlier, or any other questions that you may have. And any questions related to, even if you feel you can't join. And there's one thing I would really urge is that we have already got 14, 15 participants for the workshop. And a lot of people have asked queries who can't afford this workshop. And they are patients who have, because of a condition, they have lost their jobs, so they're not able to, sponsor themselves for the workshop, but they really want to learn. So I would say if you can afford 3499, and then please by all means pay 3499, because just by not giving that extra 500, we can support a lot of people who need this, but who can't afford this, only by people who can afford it and can pay for this. So if you think you can afford it, and if you want to pay the full price, we would really appreciate that gesture. If you have people in your life who you think will need it but can't afford it, then please sponsor them. And we are ourselves sponsoring many people on this workshop, which is starting on Sunday, who need this but perhaps can't afford it. So, and as I said that, money is not always a reflection on everything. So see for yourself, this session is being recorded. And if you have any doubts, any questions, if you can't make it for the workshop, that's also fine. I have a very nice list of names that you can see. I'm going to again put just for one last second, I'm going to put the presentation. These are some of the few names that I have worked with, I have researched. These are my teachers. And go ahead, guys, look them up, do your work, find your resources. Don't believe what I'm saying if you don't want to, but you'll find enough evidence once you do the research. Yeah. So on
Dr.
that note,
Nupur,
I
a
would,
quick question.
yeah. Yes, please.
Timing is my problem. Money is not the problem. 3:30 would be 3:30 here. So can I buy the recording of the workshop that you're doing?
Yes.
I don't mind buying it.
Ashmita will be recording it, right?
Yes, we will be. And Mr. Jani, I'll be in touch with you on this piece. I will connect with you.
Great. Thank you.
And also, I am there. I'll be very happy to assist if you are not in the same time zone. I am also available, because we are doing it in 2 parts. We are also going to be having a lot of support in the community. So my intention is to have a support group also in the community, So you will be able to share on the WhatsApp group. You'll be able to access whatever I share in the group, also. So the time zones may be different, but I am always there. And if anybody wants any one-to-one, it'll be obviously available during the workshop also. Any one-to-one consultations, in the best of my ability, I'll be able to offer.
Right. Thank you. Understood.
Thank you. Any other hands that I probably missed?
I request everybody to fill up. Yeah. No.
Just asking one question. Can I?
Yes, please. Of course. Hi, Sanjay.
Yeah. Hi. This that saliva case study which you mentioned, the person who had a dry tongue, no saliva, and you. So how many sessions did you heal that person, and for how long he was having that problem? That ailment, and was it from the birth, or what triggered it?
No. So this was a patient with head and neck cancer. And he was undergoing radiotherapy and chemotherapy. And one of the very common side effects of radio in head and neck cancer is xerostomia, or dry mouth. And he'd been having it for almost a few months, if not a year, almost 5-6 months. And he was on artificial saliva. So there is something which is called the artificial saliva. Like we have artificial tears, we have artificial saliva. And obviously that was not the most ideal. And the patient was referred to me. And within 3 sessions, these were one-to-one sessions, there was a drastic drastic improvement in the salivary flow. And that's what was documented by the dietitian. And that is what was observed. And the patient himself was able to eat and speak and swallow, because all these reflexes are very linked to the saliva. And also, a lot of times, so I hope I've answered that question. But what also I want to talk about is the swallowing reflex, which I have seen very deeply how much can get helped in an aversion to foods, you know, and a lot of other side effects which I have seen in patients. Body dysmorphia, patients with breast cancer, once they get mastectomy done, inability to accept their bodies, and the shame that comes with it. There's so much that, you know, we go through in our lives because of our illness, stress, anxiety, social ostracism, lack of, a lot of people lose their relationships, you know, they lose jobs. So there is a lot that these therapies can help them through.
And each session lasts how long?
These were all one-to-one sessions, Sanjay. They would last for 45 minutes to 1 hour with me. So I do one-to-one sessions. So in hospitals, I used to do one-to-one sessions. I do one-to-one sessions in my private practice. But this, what we are offering you today, is a workshop. So typically a one-to-one session would last for 45 minutes to 1 hour and 15 minutes, depending on the patient and the client.
Including that.
So you mentioned that you would be willing to do one-to-one sessions. So would that be online?
One-to-one, maybe I can't offer one-to-one sessions to all the people, but if you have any doubts and if you're not in the same time zone, if you're missing the recordings, then I'm more than happy to speak to a person for 15, 20 minutes, half an hour, and help them with the issues. Yeah, but I obviously offer one-to-one sessions, which will not be a part of this workshop. They'll have to be accessed separately.
Yeah,
but I'd be very happy.
That,
yeah, yes, I do one-to-one sessions. I've been doing them over Zoom for the last 2 years through the pandemic. Yes.
We would be very happy if you join this workshop because you will have your other friends also along with you, and it will be a beautiful journey.
And the tools that I can teach in the group to everybody, because it's going to be quite intense. A lot has been planned for those 2 hours, for those 2 days. And we also have a bonus session for which we don't know when we'll have that, but at some point we'll have a third bonus session where we can, you know, notice how people are doing, how people have experienced everything. So that also we will be doing. So yeah, so there'll be a lot that will be organized. And this workshop is only because in honor of World Cancer Day, which is in February. And that's why this has all come about. So that's the reason.
Thank you very much.
Wonderful. So I think we have come to the end of the workshop. And if anybody has any questions, I'd be happy to take. Otherwise, maybe we can close the session now.
Hi, Nupur.
Hello, Hima.
Hi. So I have a question. I work in a special needs school, like a writing and learning difficulty school, where we have around 100 to 120 students. So can I inform them about this therapy that you're going to offer? Like many children have learning difficulty, and physically also they can't put their back spine erect and sit in namaste when I teach them yoga. So can I inform about them about this therapy that you're going to offer?
So this therapy will be very effective, but we are not, for children, we need a slightly different approach. So I would at this point probably say that let's not get children in the workshop, because I do work with children and we need to design and align it very differently. And especially if they're special, with special abilities. If they have ADHD, or if they have any other learning disabilities.
Students are coming into the category of autism and all that.
Autism.
There are 50% of the children who look very normal, but they have some blockages.
That's what I'm saying. It's not about the looks, it's about the diagnosis, and they could be under the autistic spectrum. They could be in a very different. So for anyways, this workshop is not designed for children, Hima, but thank you for asking that. It's for 18 and above.
Students also.
Their parents can definitely benefit. But we are not going to be dealing with autism and autistic disorders at this point in time. This is going to be purely for adults with physical health issues who are facing mental challenges like anxiety, stress, and depression. For autism and autistic disorders, I'm very happy to organize something at a later date. But having said that, the parents of these children will really benefit when they learn certain techniques. But they would need a bit more specialized approach because of autism or ADHD or any other learning disability. So yeah, it needs a different focus.
A different pattern of study and then.
Yeah. Though the techniques are very same, but yes, it will need a bit of a special focus.
Like they may be dealing with crisis of attention, all that.
Yeah,
Can
exactly.
can we guide those parents like how to treat the child or something? Even you
Absolutely.
offer those kind of
Mindfulness is very, very powerful for children with ADHD and attention deficit hyperactive disorders. So it's very, very helpful. Mindfulness is in fact taught here for autism and ADHD. So yes, by all means, yes, it's very powerful.
I'll connect to my principal head and put an this request if she is interested to talk to the parents and connect them to you.
Absolutely, absolutely. Thank you so much. Thank you, Hima, and thank you everybody for
may I request just a last bit of thing? May I request everybody to join our WhatsApp link so that we can be part of the same family? I would. There is a link which I have shared. You can just join that.
So, this is all without medicine, right? You're gonna.
We don't, yes, this is all managing through mind body work, and we don't change medication. Even if you are on any medication, we don't reduce anything without consulting your physician, your GPs, without consulting your doctors. We are learning techniques and tools, and once we start to feel the effect of it, in collaboration with our doctors and GPs only, we will change any medication. You will not do any medical, nothing gets changed at the paradigm of medicine and clinical stuff. These are all self-help techniques that you will learn: subconscious reprogramming, pain management, accessing the wisdom of the body. How do you activate parasympathetic nervous system? How do you use the observer effect? What are the elevated emotions? What are the level of consciousness? Are we in the victim consciousness? Can we change our consciousness? How do we use the mind-body connect to speak to our organs? How do we use the language of communication to speak to our illness, to our pain, to our tumors? So, these are the techniques that you will be learning there.
Nupur ma'am, I am having one clarification from you.
Yes,
is
please.
it helpful for a patients who are having the mood disorders?
Okay, tell me a bit more about what kind of mood disorders.
Very good question.
It can be a type of a depression, we can say. If a person is a very happy, then it is a very means stabilization. Matlab, we can say the mental state of that person is not balanced, we can say. Sometimes he will think about the very differently. Matlab, he behaves like I am like a Donald Trump, like that. Matlab, the waves will go very high.
I understand. So like bipolar and schizophrenia.
Yeah.
So I would say if you are medically diagnosed with bipolar and schizophrenia, then ideally I would recommend one-to-one sessions, because they would need a very, very specialized approach and a little more focus on them. So with mental health conditions like schizophrenia, bipolar, these, because there are also personality dissociative disorders, right? So it will be more effective for them if they are more in a one-to-one session rather than in a group session. Once they have got some stabilization through one-to-one, then they are very welcome to join group sessions. But that will be when we launch this the workshop subsequently. But perhaps not at this point, unless they have had a one-to-one. I would not recommend that anybody with a mental health disorder like a bipolar, schizophrenia, or any personality disorders to come for this.
Thank you so much, ma'am. Yeah.
Thank you.
Thank you so much, Nupur. That was a wonderful session.
Thank you so much. Thank you. And please share it with people who you think in your life may need it and would benefit from it. And if you can sponsor somebody who is financially not capable, but they really need this, so then that would be great service. And this being the cancer month, let's support and help people with chronic health conditions and cancer. Thank you so much, Archana.
Thank you. Thank you, everybody.
Thank you, Doctor.
Thank you, Doctor.
Thank you.
Wonderful
Thank you,
session.
Preeti.
Very wonderful session. Thank you.
Thank you.
Thank you. Thank you so much. Really appreciate it.
Yeah, thank you,
And
Doctor.
if you have any questions, please go ahead. Yeah, thanks. Thank you, Sanjay.
Thank you so much, Dr. Nupur. God bless.
Thank you. Thank you very much. Thank you. All right, so we shall close it for now, Ashmita.
Yes, anyone has any question, we can still take if there is any query, or you can get in touch with us on our
Yeah.
WhatsApp.
Yeah, everybody has your WhatsApp, I hope. Yeah,
Yes, everyone has my number.
perfect. Thank you. Thank you, everybody. Bye. Have a lovely
Bye.
evening. Have a
Bye.
lovely morning,
Thank you.
wherever you are.
Bye.
Bye.
Thank you for your time.
Thank
Thank
you.
you. My pleasure. Thank you. Bye.